Hi, I'm Jack Cush, and this is QD video brought to you by RheumNow.Live or RheumNow.Live, a weekend CME investment in a newer, smarter, better you. This lesson today is about a 50-year-old with inflammatory oligoarthritis and carpal tunnel syndrome going on for 3 months. He's had bilateral carpal tunnel syndrome. In fact, he was going to come to me to have bilateral wrist surgery for his carpal tunnels. And he had swelling. He had one other swollen joint in the finger. And so I worked him up and treated him. Gave him some prednisone, gave him some Decadron, did some labs, brought him back. He was somewhat better. He's had no response to nonsteroidals. He sort of had a so-so response, good to steroids in sort of big doses. And yet he still has carpal tunnel syndrome, wrist pain, his finger is better. So we're now like into week 12 of this. And the question is, what do you call this and how do you treat it? When he first presented, he also had girdle soreness. He's had some shoulder problems in the past, rotator cuff damage from sports, but also had some hip sort of soreness. So morning stiffness was 45 minutes. He had girdle soreness and stiffness. He had 1 or 2, 3 swollen joints, a slightly elevated ESR and a CRP of 2 or 1 to 2 milligrams per deciliter elevated. And everything else negative. You imagine it, I did it, was negative. X-rays, I didn't do. So initially we thought, this could be PMR, polymyalgia rheumatica, but he's only 50 years old. He's not had a big response to 20 milligrams of prednisone. And he continues to have complaints despite prednisone. So PMR is not on my list anymore. It was on at the first visit, but not now. The question is, again, do you call this inflammatory arthritis and just treat it as such? Or do you call this seronegative arthritis? Or do you keep searching despite having 2 rounds of more extensive testing? And again, his uric acid, B27, ANA, quantiferon, hepatitis tests are all negative. So I'll tell you my approach to this. I prefer to call this, at this point, because it's 12 weeks, the dividing line of chronicity. This is going to be a chronic inflammatory oligoarthritis. It's on its way to being a polyarthritis. That's not for me, I hope. We're going to disregard the call. But the question is, what do you call it? I call this seronegative arthritis and not inflammatory arthritis because I believe 2 joints can become 3, can become 4 if you're not paying attention. And I don't want this to go untreated. So he's going to be treated with methotrexate. He's started on drug, and we'll see how he's doing in a few weeks. He's still on prednisone. And we're going to continue to look as the great Owen Kavanaugh wrote about in one of our RheumNow blogs. He said, someone with rheumatoid arthritis who's seronegative is really your invitation to reconsider the diagnosis at every visit, but also to reconsider the idea of withdrawing therapy at every visit should they be in sustained remission. So again, I prefer to call such patients seronegative RA, manage them aggressively, hopefully put them into remission, and then answer the question later on, a year from now, 18 months from now, can we get off therapy? Until then, aggressive therapy is the way to go. That's it for QD video. Tune in tomorrow.